Question 1. A newly licensed nurse is preparing to administer medications to a client. Which actions demonstrate adherence to safe medication administration practices? Select all that apply. A. Administering a medication without an electronic medication administration record, MR, available, relying on a written order from the chart. B. Asking the client to state their name and date of birth before administering the medication. C. Recalculating a pediatric medication dose with another nurse if the dose seems unusually high or low. D. Documenting the medication administration immediately after delivering the medication to the client. E. Crushing an extended-release tablet for a client with dysphagia after verifying with the pharmacist. F. Scanning the client's wristband and the medication's barcode at the bedside. Answer. Asking the client to state their name and date of birth before administering the medication, recalculating a pediatric medication dose with another nurse if the dose seems unusually high or low, documenting the medication administration immediately after delivering the medication to the client, scanning the client's wristband and the medication's barcode at the bedside. This question tests the nurse's understanding of the rights of medication administration and essential safety checks. Important clues include safe medication administration practices and newly licensed nurse, implying a need for strict adherence to protocols. Verifying client identity, independently rechecking critical calculations, immediate documentation post-administration, and utilizing barcode scanning are all fundamental safeguards that prevent errors and ensure accountability. Crushing an extended-release tablet alters its pharmacokinetics and is generally contraindicated, even with pharmacist verification, and administering without an MR is unsafe practice. Remember, always prioritize client safety and adhere to established protocols to prevent medication errors. Question 2. The nurse is caring for a client who is actively bleeding from a traumatic injury. Which actions should the nurse prioritize to manage this emergency? Select all that apply. A. Apply direct pressure to the bleeding site. B. Initiate large-bore intravenous access for fluid resuscitation. C. Prepare for immediate surgical intervention. D. Administer analgesic medication as ordered. E. Elevate the injured extremity above the level of the heart. F. Obtain a detailed history of the injury from the client. Answer. Apply direct pressure to the bleeding site, initiate large-bore intravenous access for fluid resuscitation, elevate the injured extremity above the level of the heart. This question assesses the nurse's ability to prioritize interventions during an acute hemorrhage, focusing on immediate life-saving measures. The keyword actively bleeding signifies an emergency requiring rapid, effective actions. Applying direct pressure, establishing large-bore access for fluid replacement to combat hypovolemic shock, and elevating an injured extremity, if applicable, are critical initial steps to control bleeding and support circulation. While pain control, surgical preparation, and history taking are important, they are secondary to stopping the bleeding and stabilizing the client's hemodynamics. Always remember the ABCs, airway, breathing, circulation, and prioritize interventions that directly address immediate threats to life. Question 3. A client with a new diagnosis of heart failure is being discharged. The nurse is providing education regarding self-management. Which instructions are essential to include? Select all that apply. A. Restrict fluid intake to 1.5 to 2 liters per day. B. Report a weight gain of more than 2 pounds in 1 day or 5 pounds in a week. C. Increase dietary sodium intake to help maintain electrolyte balance. D. Engage in moderate intensity aerobic exercise for at least 60 minutes daily. E. Monitor for swelling in the ankles, feet, or abdomen daily. F. Take prescribed diuretics only when experiencing shortness of breath. Answer. Restrict fluid intake to 1.5 to 2 liters per day, report a weight gain of more than 2 pounds in 1 day or 5 pounds in a week. Monitor for swelling in the ankles, feet, or abdomen daily. This question evaluates the nurse's understanding of discharge teaching for heart failure, focusing on preventing exacerbations and promoting self-management. The keywords new diagnosis and self-management highlight the need for comprehensive education on lifestyle modifications and symptom monitoring. Restricting fluid intake helps prevent fluid overload. Monitoring daily weight is crucial for detecting early fluid retention, and watching for peripheral edema are all vital strategies to manage heart failure symptoms. Increasing sodium, strenuous exercise, and taking diuretics only when symptomatic can worsen the condition. Remind clients that consistent self-monitoring is key to managing chronic conditions effectively. Question 4. The nurse is caring for an elderly client who recently experienced a fall. Which interventions should the nurse implement to prevent future falls in this client? Select all that apply. A. Ensure the call light is within easy reach at all times. B. Keep the client's bed in the lowest position with side rails up X2. C. Encourage the client to wear non-skid footwear. D. Provide regular toileting assistance and respond promptly to call lights. E. Instruct the client to use a gait belt when ambulating independently. F. Review all medications for potential side effects that increase fall risk. Answer. Ensure the call light is within easy reach at all times. Keep the client's bed in the lowest position with side rails up X2. Encourage the client to wear non-skid footwear. Provide regular toileting assistance and respond promptly to call lights. Review all medications for potential side effects that increase fall risk. This question tests the nurse's knowledge of comprehensive fall prevention strategies, particularly for an at-risk elderly client. The keywords elderly client and recently experienced a fall indicate a high priority for proactive safety measures. Keeping the call light accessible, maintaining a low bed position with side rails, typically 2, as 4 can be considered a restraint, promoting non-skid footwear, offering timely toileting, and reviewing medications for sedating or hypotensive effects are all critical interventions to mitigate fall risk. A gait belt is used for assisted ambulation, not for independent ambulation, and instructing them to use it independently when they should be assisted is incorrect. Always think holistically about the client's environment, mobility, and medication profile when planning fall prevention. Question 5. A nurse is preparing a sterile field for a dressing change. Which actions indicate proper aseptic technique? Select all that apply. A. Donning sterile gloves before opening the sterile dressing tray. B. Keeping sterile items within the line of sight and above waist level. C. Opening the sterile package away from the body first. D. Reaching over the sterile field to retrieve an item. E. Touching the outer 1-inch border of the sterile field when arranging supplies. F. Pouring a sterile solution into a sterile basin from a distance of 10 to 15 centimeters. Answer. Keeping sterile items within the line of sight and above waist level, opening the sterile package away from the body first, pouring a sterile solution into a sterile basin from a distance of 10 to 15 centimeters. This question assesses the nurse's understanding of fundamental principles of maintaining a sterile field. The key phrase, proper aseptic technique, emphasizes the need to prevent contamination rigorously. Keeping all sterile items within view and above waist level, opening the first flap of a sterile package away from the body, and pouring sterile solutions without splashing from a short distance all help maintain sterility. Donning sterile gloves after setting up the sterile field, reaching over the field, and touching the 1-inch border are all actions that would contaminate the field. Remember, if there is any doubt about sterility, consider the item contaminated and replace it. Question 6. The nurse is caring for a client with a nasogastric (NG) tube inserted for gastric decompression. Which assessment findings require immediate intervention? Select all that apply. A. Client reports nausea and abdominal distension. B. Output from the NG tube decreases significantly. C. Bowel sounds are absent in all 4 quadrants. D. Client develops a persistent cough during tube feedings. E. Gastric aspirate pH is 6.5. F. The client's nasal passage shows signs of irritation. Answer. Client reports nausea and abdominal distension. Output from the NG tube decreases significantly. Client develops a persistent cough during tube feedings. Gastric aspirate pH is 6.5. This question tests the nurse's ability to recognize signs of potential complications related to an NG tube, demanding immediate action. The phrase immediate intervention highlights critical warning signs. Nausea and abdominal distension with decreased NG output could indicate tube obstruction or improper placement, while a persistent cough during feedings suggests aspiration. A gastric aspirate pH of 6.5 is too high for the stomach, indicating the tube might be in the respiratory tract or intestines, requiring verification. Absent bowel sounds are expected with decompression, and minor nasal irritation can be managed with routine care, so these are not immediate emergencies. Always prioritize airway protection and ensure proper tube function and placement. Question 7. A client is receiving total parenteral nutrition, TPN, via a central venous catheter. Which nursing actions are appropriate to ensure client safety? Select all that apply. A. Monitor blood glucose levels every 4 to 6 hours. B. Change the TPN tubing and filter every 72 hours. C. Administer TPN using an infusion pump. D. Discontinue TPN abruptly if a new oral diet is initiated. E. Assess the central line insertion site for signs of infection daily. F. Add prescribed medications directly to the TPN bag. Answer. Monitor blood glucose levels every 4 to 6 hours. Administer TPN using an infusion pump. Assess the central line insertion site for signs of infection daily. This question evaluates the nurse's understanding of safe management practices for clients receiving total parenteral nutrition, TPN. Ensuring client safety is paramount with TPN due to its complexity and potential complications. Monitoring blood glucose frequently is essential due to the high dextrose content. Administering TPN via an infusion pump ensures precise delivery, and daily assessment of the central line site helps detect infection early. TPN tubing and filter should be changed every 24 hours, not 72, and TPN should be gradually tapered, not abruptly discontinued, to prevent rebound hypoglycemia. Medications should never be added directly to the TPN bag due to compatibility issues and infection risk. Consistent monitoring and strict adherence to protocol are vital for TPN safety. Question 8. The nurse is providing care for a client with Clostridium difficile, C. difficile, infection. Which infection control measures are appropriate for this client? Select all that apply. A. Place the client in a private room. B. Wear a gown and gloves when entering the client's room. C. Use an alcohol-based hand sanitizer after exiting the client's room. D. Dedicate non-critical equipment, e.g., stethoscope, blood pressure cuff, to the client's room. E. Ensure environmental surfaces are cleaned with a bleach-containing disinfectant. F. Instruct visitors to wear a surgical mask when in the client's room. Answer. Place the client in a private room, wear a gown and gloves when entering the client's room, dedicate non-critical equipment, e.g., stethoscope, blood pressure cuff, to the client's room, ensure environmental surfaces are cleaned with a bleach-containing disinfectant. This question assesses the nurse's knowledge of specific infection control precautions for Clostridium difficile, a highly transmissible and spore-forming bacterium. The critical clue is C. difficile infection, which requires contact precautions. Placing the client in a private room, wearing a gown and gloves, dedicating equipment to prevent cross-contamination, and using bleach-based disinfectants, as alcohol is ineffective against C. difficile spores, are all essential to prevent spread. Alcohol-based hand sanitizer is insufficient. Thorough hand-washing with soap and water is required. Surgical masks are not necessary for contact precautions. Always remember that strict adherence to contact precautions, especially proper hand hygiene with soap and water, is crucial for preventing C. difficile transmission. Question 9. The nurse is preparing to delegate tasks to a licensed practical nurse, LPN, and an unlicensed assistive personnel, UAP. Which tasks are appropriate to delegate? Select all that apply. A. LPN, administering an oral antibiotic to a stable client. B. UAP, providing post-mortem care to a client. C. LPN, developing the nursing care plan for a newly admitted client. D. UAP, documenting a client's intake and output. E. LPN, teaching a client about new diabetic medication. F. UAP, performing initial assessment on a client experiencing chest pain. Answer: LPN, administering an oral antibiotic to a stable client. UAP, providing post-mortem care to a client. UAP, documenting a client's intake and output. This question tests the nurse's understanding of delegation principles, focusing on the scope of practice for LPNs and UAPs. The concept is appropriate delegation, meaning assigning tasks that are within the legal and educational scope of the healthcare professional. Administering an oral antibiotic to a stable client is within an LPN scope. Post-mortem care and documenting intake/output are standard tasks for UAPs. Developing a nursing care plan, teaching about new medications, and performing an initial assessment for chest pain, which requires critical thinking and advanced assessment skills, are responsibilities of the registered nurse, RN. Always remember the 5 rights of delegation: right task, right circumstances, right person, right direction/communication, and right supervision/evaluation. Question 10. A client is receiving continuous enteral feedings via a gastrostomy tube. Which nursing interventions are appropriate to prevent complications? Select all that apply. A. Elevate the head of the bed to at least 30 to 45 degrees during feedings and for 30 to 60 minutes afterward. B. Check gastric residual volume every 24 hours. C. Flush the tube with 30 milliliters of water before and after medication administration. D. Administer cold formula directly from the refrigerator to improve tolerance. E. Assess the gastrostomy site daily for signs of infection or leakage. F. Withhold feedings if gastric residual volume is greater than 500 milliliters in a single measurement. Answer: elevate the head of the bed to at least 30 to 45 degrees during feedings and for 30 to 60 minutes afterward. Flush the tube with 30 milliliters of water before and after medication administration. Assess the gastrostomy site daily for signs of infection or leakage. Withhold feedings if gastric residual volume is greater than 500 milliliters in a single measurement. This question tests the nurse's knowledge of best practices for managing continuous enteral feedings to prevent complications like aspiration, tube occlusion, and infection. The phrase "prevent complications" is a key indicator to identify proactive and safe nursing actions. Elevating the head of the bed reduces aspiration risk, flushing the tube prevents clogging, daily site assessment monitors for infection, and withholding feedings for large residuals prevents overfilling and potential aspiration. Checking residuals every 4 to 6 hours, not 24, is standard, and formula should be administered at room temperature to avoid cramping. Remember, careful monitoring and adherence to protocol are essential for safe enteral feeding. Question 11. The nurse is caring for a client with a Do Not Resuscitate (DNR) order. Which actions are consistent with ethical and legal guidelines for DNR orders? Select all that apply. A. Continuing to provide comfort measures, such as pain management. B. Informing family members that no medical care will be provided for the client. C. Discussing the client's wishes with the interdisciplinary team. D. Ensuring the DNR order is clearly documented in the client's medical record. E. Activating the rapid response team if the client experiences acute shortness of breath. F. Respecting the client's right to change their mind about the DNR order at any time. Answer. Continuing to provide comfort measures, such as pain management, discussing the client's wishes with the interdisciplinary team, ensuring the DNR order is clearly documented in the client's medical record, respecting the client's right to change their mind about the DNR order at any time. This question assesses the nurse's understanding of ethical and legal responsibilities concerning do not resuscitate DNR orders. The keywords ethical and legal guidelines highlight the importance of respecting client autonomy and providing appropriate care. A DNR order means no heroic life-saving measures like CPR or defibrillation, but it does not mean withholding other medical care or comfort measures like pain management. Ensuring clear documentation, communicating the client's wishes to the team, and recognizing the client's right to revoke the order are crucial. Informing family that no medical care will be provided is inaccurate, and activating a rapid response team for acute shortness of breath in a DNR client is typically inconsistent with the order, as it implies intervention beyond comfort care. Always clarify and follow the specific scope of the DNR order while upholding client dignity. Question 12. A client is experiencing an anaphylactic reaction after receiving a new medication. Which assessment findings would the nurse expect to observe? Select all that apply. A. Bronchoconstriction and wheezing. B. Generalized urticaria, hives, and pruritus, itching. C. Hypertension and bradycardia. D. Increased cardiac output. E. Angioedema, swelling, of the face and throat. F. Hypotension and tachycardia. Answer. Bronchoconstriction and wheezing, generalized urticaria, hives, and pruritus, itching, angioedema, swelling, of the face and throat, hypotension and tachycardia. This question tests the nurse's ability to recognize the classic signs and symptoms of an anaphylactic reaction, which is a severe, life-threatening allergic response. The key phrase anaphylactic reaction indicates a systemic response affecting multiple body systems. Bronchoconstriction, leading to wheezing and dyspnea, generalized urticaria, hives, and pruritus, itching, angioedema, swelling, of the face and throat, and hypotension with tachycardia are all hallmark signs. Anaphylaxis causes vasodilation, leading to low blood pressure and a compensatory fast heart rate, not hypertension or bradycardia, nor increased cardiac output. Recognize these signs quickly, as anaphylaxis requires immediate intervention. Question 13. The nurse is preparing to administer an intramuscular injection. Which steps are crucial to ensure safe administration? Select all that apply. A. Select a 25-gauge, 5/8-inch needle for an adult client. B. Cleanse the injection site with an antiseptic solution in a circular motion, moving outward. C. Pull back on the plunger, aspirate, to check for blood return before injecting the medication. D. Inject the medication slowly at a 90-degree angle. E. Administer the injection in the vastus lateralis muscle for an infant. F. Massage the injection site vigorously after medication administration to aid absorption. Answer. Cleanse the injection site with an antiseptic solution in a circular motion, moving outward, inject the medication slowly at a 90-degree angle, administer the injection in the vastus lateralis muscle for an infant. This question assesses the nurse's knowledge of proper technique for safe intramuscular, IM, injections, focusing on preventing complications and ensuring therapeutic effects. Safe administration is the core concept. Cleansing the site outward, injecting slowly at a 90-degree angle, and using the vastus lateralis for infants are correct practices. A 25 gauge, 5/8 inch needle is typically too short and small for an adult IM injection. Aspiration is generally no longer recommended by current evidence-based guidelines for most vaccines and medications, but still sometimes taught depending on institutional policy. Massaging the site after administration can cause tissue damage and promote leakage of medication, so it should be avoided. Always ensure proper needle size, site selection, and technique for IM injections. Question 14. A client is admitted with fluid volume deficit, dehydration. Which assessment findings would the nurse expect to observe? Select all that apply. A. Bounding peripheral pulses. B. Dry mucous membranes. C. Increased urine output. D. Flat neck veins. E. Hypotension and tachycardia. F. Decreased skin turgor. Answer: dry mucous membranes, flat neck veins, hypotension and tachycardia, decreased skin turgor. This question tests the nurse's ability to identify clinical manifestations of fluid volume deficit, dehydration. The keyword fluid volume deficit indicates a lack of circulating fluid, leading to specific physiological responses. Dry mucous membranes, flat neck veins, due to decreased venous filling, hypotension and tachycardia, as the heart compensates for reduced blood volume, and decreased skin turgor are all classic signs of dehydration. Bounding pulses and increased urine output are signs of fluid volume excess, not deficit. Recognizing these signs is critical for prompt and effective rehydration therapy. Question 15. The nurse is educating a client about the proper use of crutches. Which instructions should the nurse include in the teaching plan? Select all that apply. A. Bear weight on the axilla, armpits, to provide stability. B. Keep crutch tips 6 inches in front and 6 inches to the side of the feet. C. Ascend stairs by leading with the unaffected leg, followed by the crutches and affected leg. D. Use the 3-point gait for partial weight bearing. E. Ensure that crutch pads are approximately 2 to 3 finger widths below the axilla. F. Descend stairs by leading with the affected leg and crutches, followed by the unaffected leg. Answer: keep crutch tips 6 inches in front and 6 inches to the side of the feet. Ascend stairs by leading with the unaffected leg, followed by the crutches and affected leg. Ensure that crutch pads are approximately 2 to 3 finger widths below the axilla. Descend stairs by leading with the affected leg and crutches, followed by the unaffected leg. This question assesses the nurse's knowledge of safe and effective crutch use, focusing on proper body mechanics and preventing injury. The clue proper use of crutches implies adherence to established guidelines. Correct crutch placement, 6 inches in front/side, ascending stairs with the unaffected leg first, ensuring proper crutch height, 2 to 3 finger widths below the axilla to prevent nerve damage, and descending stairs with the affected leg and crutches first are all correct. Bearing weight on the axilla can cause nerve damage, and the 3-point gait is used for non-weight bearing, not partial weight bearing, which typically uses a 4-point or 2-point gait. Proper crutch teaching is vital for client mobility and safety. Question 16. The nurse is caring for a client who is experiencing an acute asthma exacerbation. Which assessment findings indicate worsening respiratory status and require immediate intervention? Select all that apply. A. Productive cough with clear sputum. B. Diminished or absent breath sounds. C. Use of accessory muscles for breathing. D. Oxygen saturation of 94% on room air. E. Paradoxical breathing, chest wall sinks in on inspiration. F. Bradypnea, slow breathing rate. Answer: diminished or absent breath sounds, use of accessory muscles for breathing, paradoxical breathing, chest wall sinks in on inspiration. This question evaluates the nurse's ability to recognize critical signs of deteriorating respiratory function in a client with an asthma exacerbation, requiring urgent intervention. Worsening respiratory status is the key phrase. Diminished or absent breath sounds indicate severe airway obstruction, use of accessory muscles signifies increased work of breathing, and paradoxical breathing points to respiratory muscle fatigue and impending respiratory failure. A productive cough with clear sputum and an oxygen saturation of 94% are not necessarily signs of worsening status in an acute exacerbation, and bradypnea in an acute asthmatic suggests severe fatigue and is a very late and ominous sign. Rapid recognition and intervention are vital to prevent respiratory arrest. Question 17. The nurse is preparing to administer intravenous 4. Potassium chloride. Which actions are essential to ensure client safety? Select all that apply. A. Administer the potassium chloride undiluted via 4-push. B. Confirm the client's urine output is adequate before administration. C. Administer potassium chloride through a central venous catheter only. D. Infuse the potassium chloride slowly, typically no faster than 10 milliequivalent/hour. E. Dilute the potassium chloride in a large volume of 4 solution. F. Monitor the client's cardiac rhythm continuously during infusion. Answer. Confirm the client's urine output is adequate before administration. Infuse the potassium chloride slowly, typically no faster than 10 milliequivalent/hour. Dilute the potassium chloride in a large volume of 4 solution. Monitor the client's cardiac rhythm continuously during infusion. This question assesses the nurse's critical knowledge regarding the safe administration of intravenous potassium chloride, a high-alert medication. The crucial phrase, ensure client safety, emphasizes strict adherence to protocols. Administering potassium chloride diluted, slowly, never 4-push, ensuring adequate urine output, to prevent hyperkalemia, and continuous cardiac monitoring are all essential to prevent life-threatening cardiac dysrhythmias. Potassium chloride can be administered peripherally if sufficiently diluted, not only via central line. Always treat potassium chloride with extreme caution due to its high alert status. Question 18. A client has a prescription for a clear liquid diet. Which food and beverage items are appropriate for the nurse to offer this client? Select all that apply. A. Cream of mushroom soup. B. Gelatin. C. Apple juice. D. Sherbet. E. Broth. F. Popsicles. Answer. Gelatin, apple juice, broth, popsicles. This question tests the nurse's knowledge of dietary restrictions, specifically what constitutes a clear liquid diet. The key phrase clear liquid diet refers to foods that are liquid at room temperature and leave no undigested residue. Gelatin, apple juice, or other pulp-free juices, clear broth, and popsicles are all appropriate as they are transparent and easily digested. Cream soup contains milk and solids, and sherbet is opaque and contains dairy, making them unsuitable for a clear liquid diet. Remember, the goal of a clear liquid diet is to provide hydration and some electrolytes without stimulating the GI tract. Question 19. The nurse is conducting a health history for a client suspected of elder abuse. Which observations or statements would raise the nurse's suspicion of elder abuse? Select all that apply. A. The client provides a consistent and clear explanation for their injuries. B. The client appears withdrawn, fearful, and reluctant to speak in front of their caregiver. C. The caregiver frequently interrupts the client and answers questions directed at the client. D. There are multiple bruises in various stages of healing, inconsistent with the reported mechanism of injury. E. The client's financial resources are being managed by a distant relative. F. The client shows signs of poor hygiene, malnutrition, or untreated medical conditions. Answer. The client appears withdrawn, fearful, and reluctant to speak in front of their caregiver. The caregiver frequently interrupts the client and answers questions directed at the client. There are multiple bruises in various stages of healing, inconsistent with the reported mechanism of injury. The client shows signs of poor hygiene, malnutrition, or untreated medical conditions. This question assesses the nurse's ability to identify potential indicators of elder abuse, a critical aspect of client advocacy. The keywords elder abuse and raise suspicion prompt the nurse to look for red flags. Client fear or reluctance to speak, caregiver dominance, injuries inconsistent with explanations, and signs of neglect, poor hygiene, malnutrition, untreated conditions, are strong indicators of abuse. A consistent explanation for injuries would reduce suspicion, and while distant relatives managing finances could be legitimate, it's less direct evidence of abuse than other options. Nurses have a legal and ethical obligation to report suspected elder abuse. Question 20. The nurse is preparing to assist a client with ambulation after surgery. Which actions should the nurse take to ensure client safety? Select all that apply. A. Allow the client to dangle their feet at the bedside for a few minutes before standing. B. Encourage the client to push themselves up using their arms from a sitting position. C. Ensure the client is wearing non-skid footwear. D. Position the walking aid, e.g., walker, cane, on the client's affected side. E. Use a gait belt around the client's waist. F. Place the bed in the highest position to make it easier for the client to stand. Answer. Allow the client to dangle their feet at the bedside for a few minutes before standing. Encourage the client to push themselves up using their arms from a sitting position. Ensure the client is wearing non-skid footwear. Use a gait belt around the client's waist. This question tests the nurse's knowledge of safe practices for assisting clients with ambulation, especially post-surgery when they may be weak or dizzy. The phrase, "ensure client safety," is paramount. Dangle feet to prevent orthostatic hypotension, encourage arm use to reduce strain on legs and back, ensure non-skid footwear for traction, and use a gait belt for secure support. The walking aid should be on the unaffected, stronger, side to provide better balance, and the bed should be in the lowest position once standing to prevent falls if the client sits back down quickly. Prioritizing client stability and preventing falls is essential during ambulation. Question 21. A nurse is reviewing a client's medication list. Which medications should the nurse identify as requiring a high alert designation? Select all that apply. A. Insulin. B. Metformin. C. Warfarin. D. Acetaminophen. E. Opioids. F. Heparin. Answer. Insulin, warfarin, opioids, heparin. This question assesses the nurse's awareness of high-alert medications, which carry a heightened risk of causing significant harm when used in error. The keyword high alert is the direct clue. Insulin, warfarin, an anticoagulant, opioids, and heparin, another anticoagulant, are all medications that, if administered incorrectly, can lead to severe adverse effects or death. Metformin and acetaminophen are commonly used medications but are not typically classified as high alert, though acetaminophen in high doses can cause liver damage. Special safeguards, such as independent double checks, are often required for high alert medications. Always treat these medications with extreme caution. Question 22. The nurse is caring for a client who is NPO, nothing by mouth, and has a prescription for daily oral medications. Which nursing actions are appropriate? Select all that apply. A. Crush all medications and administer them through a nasogastric tube if present. B. Contact the prescriber to clarify if the medications can be given by an alternative route or held. C. Administer the medications with a small sip of water if the client tolerates it. D. Document the reason for withholding the medication in the client's record. E. Administer essential medications, such as cardiac or seizure medications, as ordered without clarification. F. Consult with the pharmacist regarding appropriate alternative forms, e.g., for form. Answer. Contact the prescriber to clarify if the medications can be given by an alternative route or held. Document the reason for withholding the medication in the client's record. Consult with the pharmacist regarding appropriate alternative forms, e.g., for form. This question tests the nurse's critical thinking and problem-solving skills when a client's NPO status conflicts with medication orders. The key phrase NPO and has a prescription for daily oral medications indicates a need for careful assessment and communication. The most appropriate actions involve clarifying with the prescriber, consulting the pharmacist for alternatives, and documenting any withheld medications and the reason. Crushing all medications is not always appropriate, as some medications should not be crushed. Administering even a small sip of water violates NPO status, and essential medications should still be clarified before administering if they conflict with NPO status, especially if their NPO status is due to an upcoming procedure or aspiration risk. Always advocate for client safety by clarifying conflicting orders. Question 23. A nurse is preparing to discharge a client who requires ongoing wound care at home. Which elements are essential to include in the discharge teaching plan? Select all that apply. A. Detailed written instructions on how to perform the dressing change. B. A demonstration of the dressing change by the nurse. C. Information about potential signs of wound infection and when to call the provider. D. A verbal explanation of the dressing change without a return demonstration from the client. E. Contact information for home health services or community resources if needed. F. Instructions on maintaining a sterile environment for all home wound care. Answer. Detailed written instructions on how to perform the dressing change, a demonstration of the dressing change by the nurse, information about potential signs of wound infection and when to call the provider, contact information for home health services or community resources if needed. This question assesses the nurse's ability to create a comprehensive and safe discharge teaching plan for wound care. The focus is on ongoing wound care at home, highlighting the need for practical, clear, and supportive instructions. Providing written instructions, demonstrating the procedure, teaching about infection signs, and offering community resources are all critical for successful home management. A return demonstration by the client is generally recommended to ensure understanding, so a verbal explanation alone is insufficient. While cleanliness is important, maintaining a sterile environment at home for routine wound care is often impractical and unnecessary for most clean wounds, with clean technique usually being sufficient. Ensure teaching is individualized, clear, and includes resources for support. Question 24. The nurse is educating a client about colostomy care. Which instructions are important for the nurse to include? Select all that apply. A. Empty the ostomy pouch when it is 1/3 to 1/2 full. B. Change the entire ostomy appliance daily. C. Cleanse the peristomal skin with mild soap and water and pat dry. D. Apply a skin barrier around the stoma before applying the new pouch. E. Report any changes in stoma color, e.g., pallor, cyanosis, dusky appearance, to the healthcare provider. F. Expect minimal output from the stoma in the first 24 to 48 hours after surgery. Answer. Empty the ostomy pouch when it is 1/3 to 1/2 full. Cleanse the peristomal skin with mild soap and water and pat dry. Apply a skin barrier around the stoma before applying the new pouch. Report any changes in stoma color, e.g., pallor, cyanosis, dusky appearance, to the healthcare provider. This question evaluates the nurse's understanding of essential teaching points for colostomy care, aiming to promote client self-management and prevent complications. The focus is on colostomy care. Emptying the pouch when 1/3 to 1/2 full prevents leakage and odor. Cleaning the peristomal skin gently maintains skin integrity, applying a skin barrier protects the skin, and reporting stoma color changes, which indicate perfusion issues, are all crucial. The entire appliance is typically changed every 3 to 7 days, not daily, to prevent skin irritation. Expecting minimal output in the first 24 to 48 hours is more typical for ileostomies. Colostomies generally have some output earlier. Providing clear, practical instructions empowers clients to manage their ostomy care effectively. Question 25. The nurse is preparing to administer medications to an older adult client. Which age-related physiological changes should the nurse consider when planning medication administration? Select all that apply. A. Increased gastric motility, leading to faster drug absorption. B. Decreased liver function, which can impair drug metabolism. C. Reduced kidney function, affecting drug excretion. D. Decreased total body water, potentially leading to higher drug concentrations. E. Increased muscle mass, which can alter drug distribution. F. Decreased protein binding sites, potentially increasing the amount of free drug. Answer. Decreased liver function, which can impair drug metabolism, reduced kidney function, affecting drug excretion, decreased total body water, potentially leading to higher drug concentrations, decreased protein binding sites, potentially increasing the amount of free drug. This question assesses the nurse's understanding of pharmacokinetics in older adults, crucial for safe medication administration. The key phrase, age-related physiological changes, directs the nurse to consider how aging impacts drug handling. Older adults typically experience decreased liver function, impaired metabolism, reduced kidney function, impaired excretion, decreased total body water, leading to higher drug concentrations, and fewer protein-binding sites, increasing free drug availability, all of which can increase the risk of adverse drug reactions and toxicity. Gastric motility generally decreases, not increases, and muscle mass usually decreases, not increases, in older adults. Always start low and go slow with medications in older adults, recognizing their altered physiological responses. Question 26. A client in the emergency department reports crushing chest pain radiating to the left arm. Which nursing actions are priorities upon admission? Select all that apply. A. Obtain a 12-lead electrocardiogram, ECG. B. Administer aspirin as ordered. C. Obtain a detailed pain history. D. Establish intravenous access. E. Administer sublingual nitroglycerin as ordered. F. Prepare the client for immediate cardiac catheterization. Answer. Obtain a 12-lead electrocardiogram, ECG, administer aspirin as ordered, establish intravenous access, administer sublingual nitroglycerin as ordered. This question tests the nurse's immediate priorities for a client presenting with symptoms highly suggestive of an acute myocardial infarction, heart attack. The clue, crushing chest pain, indicates a medical emergency. Obtaining an ECG, administering aspirin, to prevent clot formation, establishing for access, for medication delivery, and administering nitroglycerin, to vasodilation and reduce pain, are all critical initial interventions. While a detailed pain history is important, it should not delay life-saving actions. Immediate cardiac catheterization is a subsequent intervention, not an initial nursing action upon admission. Remember the MONA acronym, morphine, oxygen, nitroglycerin, aspirin, as a general guide for initial management of chest pain, though the order may vary based on client condition and provider orders. Question 27. The nurse is educating a client about preventing deep vein thrombosis, DVT, after surgery. Which instructions should the nurse include in the teaching? Select all that apply. A. Perform ankle pump and foot circle exercises regularly. B. Avoid ambulating for the first 48 hours to promote healing. C. Wear sequential compression devices, SCDs, or anti-embolism stockings as prescribed. D. Increase fluid intake to promote hydration. E. Limit leg elevation to prevent blood pooling. F. Report any calf pain, tenderness, or swelling to the healthcare provider. Answer. Perform ankle pump and foot circle exercises regularly, wear sequential compression devices, SCDs, or anti-embolism stockings as prescribed, increase fluid intake to promote hydration, report any calf pain, tenderness, or swelling to the healthcare provider. This question assesses the nurse's knowledge of non-pharmacological and observational strategies for preventing deep vein thrombosis, DVT, post-surgery. The concept is preventing DVT. Regular leg exercises, like ankle pumps, using SCDs or anti-embolism stockings, maintaining hydration, and prompt reporting of DVT symptoms are all crucial preventive measures. Early ambulation is encouraged, not avoided, to promote circulation. Elevating the legs is beneficial, not limited, as it helps venous return. Emphasize that mobility, hydration, and mechanical prophylaxis are cornerstones of DVT prevention. Question 28. A client is experiencing an allergic reaction to a blood transfusion. Which nursing actions are appropriate? Select all that apply. A. Stop the transfusion immediately. B. Keep the line open with normal saline at a slow rate. C. Administer prescribed antihistamines or corticosteroids. D. Send the blood bag and tubing back to the blood bank. E. Increase the transfusion rate to dilute the reaction. F. Obtain a urine sample for laboratory analysis. Answer. Stop the transfusion immediately. Keep the line open with normal saline at a slow rate. Administer prescribed antihistamines or corticosteroids. Send the blood bag and tubing back to the blood bank. Obtain a urine sample for laboratory analysis. This question tests the nurse's immediate and appropriate responses to an acute blood transfusion reaction. The key phrase, allergic reaction to a blood transfusion, signals an emergency requiring rapid, systematic actions. The absolute first step is to stop the transfusion immediately, followed by keeping the line open with normal saline to maintain access. Administering prescribed medications, antihistamines, corticosteroids, helps manage the reaction. Sending the blood bag and tubing back for analysis is crucial for identifying the cause, and a urine sample helps check for hemolytic reactions. Increasing the transfusion rate would worsen the reaction. Remember to always prioritize client safety and immediately halt the transfusion at the first sign of a reaction. Question 29. The nurse is providing care for a client with a history of seizures. Which interventions should the nurse implement to ensure client safety during a seizure event? Select all that apply. A. Place a padded tongue blade in the client's mouth to prevent biting their tongue. B. Loosen tight clothing around the client's neck. C. Turn the client to their side. D. Protect the client's head with a pillow or blanket. E. Restrain the client's extremities to prevent injury. F. Document the exact time the seizure started and ended. Answer. Loosen tight clothing around the client's neck. Turn the client to their side. Protect the client's head with a pillow or blanket. Document the exact time the seizure started and ended. This question assesses the nurse's knowledge of seizure precautions and immediate interventions to protect a client during a seizure. The concept is client safety during a seizure event. Loosening clothing, turning the client to their side, to maintain airway and prevent aspiration, patting the head, and documenting the seizure's duration are all essential safety measures. Placing anything in the client's mouth can cause injury or airway obstruction, and restraining extremities can cause musculoskeletal injury. Focus on protecting the client from harm and observing the seizure for accurate documentation. Question 30. A client with a long history of type 2 diabetes mellitus is admitted to the hospital. Which complications should the nurse assess for? Select all that apply. A. Retinopathy, eye damage. B. Peripheral neuropathy, nerve damage. C. Nephropathy, kidney damage. D. Increased susceptibility to infections. E. Hyperglycemic hyperosmolar state, HHS. F. Increased liver enzyme levels. Answer: retinopathy, eye damage, peripheral neuropathy, nerve damage, nephropathy, kidney damage, increased susceptibility to infections, hyperglycemic hyperosmolar state, HHS. This question tests the nurse's understanding of the common chronic and acute complications associated with long-term type 2 diabetes mellitus. The key phrase "long history of type 2 diabetes mellitus" directs the nurse to consider both macrovascular and microvascular complications. Retinopathy, peripheral neuropathy, nephropathy, and increased susceptibility to infections are all common long-term complications. Hyperglycemic hyperosmolar state, HHS, is an acute, life-threatening complication of type 2 diabetes. Increased liver enzymes are not a primary or direct complication of diabetes itself, although conditions like non-alcoholic fatty liver disease can be associated. Comprehensive assessment for these complications is crucial for diabetic client management. Question 31. The nurse is caring for a client who is agitated and attempting to remove their foreline. The nurse determines that restraints are necessary. Which actions are appropriate when applying restraints? Select all that apply. A. Obtain a medical order for restraints immediately, or within 1 hour of application. B. Use a quick release knot to secure the restraints to the side rail of the bed. C. Assess skin integrity and neurovascular status every 2 hours. D. Offer food, fluids, and toileting every 15 to 30 minutes. E. Remove restraints periodically, e.g., every 2 hours, to allow for range of motion and skin care. F. Document the client's behavior, intervention, and client's response. Answer: obtain a medical order for restraints immediately, or within 1 hour of application, assess skin integrity and neurovascular status every 2 hours, remove restraints periodically, e.g., every 2 hours, to allow for range of motion and skin care, document the client's behavior, intervention, and client's response. This question assesses the nurse's knowledge of the safe and legal application of client restraints, which are used only as a last resort. The core concept is restraints are necessary. Obtaining a medical order promptly, regularly assessing skin and neurovascular status, intermittently releasing restraints for basic care and movement, and thorough documentation are all essential components of safe and ethical restraint use. Restraints should never be tied to the side rail, always to the bed frame, and should use a quick release knot for safety. Offering food/fluid/toileting should be done every 2 hours, coinciding with release, not every 15 to 30 minutes. Remember, restraints are a temporary measure and require continuous monitoring and re-evaluation for their necessity. Question 32. A client is receiving a continuous bladder irrigation, CBI, after prostate surgery. Which observations by the nurse indicate a need for intervention? Select all that apply. A. Pink-tinged urine output. B. Client reports continuous bladder spasms and pain. C. Output from the catheter is significantly less than the irrigant infused. D. Urine is clear yellow with no clots. E. Frank bright red bleeding is noted in the drainage bag. F. The client is complaining of lower abdominal fullness. Answer: client reports continuous bladder spasms and pain. Output from the catheter is significantly less than the irrigant infused. Frank bright red bleeding is noted in the drainage bag. The client is complaining of lower abdominal fullness. This question evaluates the nurse's ability to identify complications during continuous bladder irrigation, CBI, following prostate surgery. The keywords CBI after prostate surgery and need for intervention guide the nurse to recognize signs of obstruction or excessive bleeding. Continuous bladder spasms and pain, output less than infusate, frank bright red bleeding, and abdominal fullness all suggest potential obstruction by clots, hemorrhage, or inadequate drainage, requiring immediate action. Pink-tinged urine is often expected, and clear yellow urine is ideal, indicating effective irrigation. Always ensure patency of the catheter and adjust irrigation rate as needed to prevent complications. Question 33. The nurse is preparing to administer an intravenous push medication. Which actions are appropriate prior to administration? Select all that apply. A. Verify the medication, dose, and route against the prescriber's order. B. Assess the client for any known allergies. C. Ensure foresight patency and absence of infiltration or phlebitis. D. Inject the medication as quickly as possible to ensure rapid effect. E. Dilute the medication with 0.9% normal saline before administration, regardless of specific instructions. F. Check medication compatibility with the primary force solution and any other infusing medications. Answer. Verify the medication, dose, and route against the prescriber's order. Assess the client for any known allergies. Ensure foresight patency and absence of infiltration or phlebitis. Check medication compatibility with the primary force solution and any other infusing medications. This question tests the nurse's knowledge of critical safety checks before administering an intravenous, push medication, which carries a higher risk due to rapid delivery. Appropriate prior to administration emphasizes preparatory safety steps. Verifying the order, the 5 rights, checking for allergies, ensuring foresight patency, and confirming medication compatibility are all essential to prevent errors and adverse reactions. Injecting as quickly as possible is incorrect and dangerous, as many push medications must be administered slowly. Medications should only be diluted if specific instructions require it, not as a blanket practice. Always prioritize meticulous verification and assessment before administering push medications. Question 34. A client is admitted with suspected septic shock. Which assessment findings should the nurse expect to observe? Select all that apply. A. Warm, flushed skin in early stages. B. Bradycardia. C. Hypotension. D. Elevated lactate levels. E. Oliguria, decreased urine output. F. Bradypnea, slow respiratory rate. Answer. Warm, flushed skin in early stages, hypotension, elevated lactate levels, oliguria, decreased urine output. This question assesses the nurse's ability to recognize the clinical manifestations of septic shock, a life-threatening condition caused by a severe infection. The clue septic shock indicates a systemic inflammatory response affecting vital organ perfusion. Expected findings include warm, flushed skin in early stages, due to vasodilation, persistent hypotension, elevated lactate levels, indicating tissue hypoperfusion and anaerobic metabolism, and oliguria, due to kidney hypoperfusion. Tachycardia, not bradycardia, is expected as the heart compensates for low blood pressure. Tachypnea, not bradypnea, is also typically seen as the body tries to compensate for metabolic acidosis. Rapid recognition and intervention are critical for managing septic shock. Question 35. The nurse is providing discharge teaching to a client with a new prescription for warfarin. Which instructions should the nurse include? Select all that apply. A. Take over-the-counter NSAIDs for pain relief as needed. B. Report any signs of bleeding, such as unusual bruising or bloody stools. C. Maintain a consistent intake of vitamin K-rich foods. D. Expect regular blood tests, INR, to monitor the medication's effect. E. Avoid electric razors and use sharp blade razors instead. F. Inform all healthcare providers, including dentists, about warfarin use. Answer. Report any signs of bleeding, such as unusual bruising or bloody stools. Maintain a consistent intake of vitamin K-rich foods. Expect regular blood tests, INR, to monitor the medication's effect. Inform all healthcare providers, including dentists, about warfarin use. This question tests the nurse's understanding of essential client education for warfarin, a high-alert anticoagulant. The keywords "new prescription for warfarin" highlight the importance of teaching about safety and monitoring. Reporting bleeding signs, maintaining consistent, not necessarily avoiding, vitamin K intake, understanding the need for regular INR monitoring, and informing all healthcare providers are crucial to prevent complications and ensure safe therapy. NSAIDs increase bleeding risk and should be avoided or used with caution, and electric razors are safer than blade razors to prevent cuts. Thorough teaching is vital for clients on anticoagulants. Question 36. A nurse is preparing to administer a subcutaneous injection. Which steps are appropriate for this route? Select all that apply. A. Choose a 25-gauge, 5/8" needle for an adult client. B. Insert the needle at a 45-degree or 90-degree angle, depending on the client's fat tissue. C. Aspirate for blood return before injecting insulin. D. Select injection sites such as the abdomen, outer aspects of the upper arms, or anterior thighs. E. Massage the injection site vigorously after administering heparin. F. Pinch the skin at the injection site for clients with minimal subcutaneous tissue. Answer. Choose a 25-gauge, 5/8" needle for an adult client. Insert the needle at a 45-degree or 90-degree angle, depending on the client's fat tissue. Select injection sites such as the abdomen, outer aspects of the upper arms, or anterior thighs. Pinch the skin at the injection site for clients with minimal subcutaneous tissue. This question assesses the nurse's knowledge of proper technique for safe subcutaneous, sub-Q, injections. The concept is appropriate for this route. Using a 25-gauge, 5/8" needle, selecting an appropriate angle, 45 or 90 degrees based on tissue, choosing correct sites, abdomen, upper arms, thighs, and pinching the skin for thinner clients are all proper techniques. Aspiration is generally not recommended for subcutaneous injections, especially for insulin. Massaging the site after heparin can increase bruising and should be avoided. Careful technique and site selection minimize discomfort and ensure proper absorption. Question 37. The nurse is assessing a client for pain. Which characteristics of pain should the nurse include in the assessment? Select all that apply. A. Location. B. Intensity. C. Quality, e.g., sharp, dull, throbbing. D. Onset and duration. E. Aggravating and alleviating factors. F. Client's preferred pain medication. Answer. Location, intensity, quality, e.g., sharp, dull, throbbing, onset and duration, aggravating and alleviating factors. This question evaluates the nurse's comprehensive approach to pain assessment, a fundamental nursing skill. The core concept is assessing a client for pain. All the listed options, location, intensity, using a scale, quality, descriptive words, onset and duration, and aggravating/alleviating factors, are essential components of a thorough pain assessment, often remembered by the acronym PQRST, palliative/provocative, quality, radiation, severity, timing. While a client's preferred medication might be relevant to a care plan, it is not a direct characteristic of the pain itself, but rather a historical preference. A complete pain assessment provides crucial information for effective pain management. Question 38. A nurse is providing care for a client in hospice. Which principles guide the care provided in a hospice setting? Select all that apply. A. Focus on aggressive treatment to cure the underlying disease. B. Provide holistic care that addresses physical, emotional, and spiritual needs. C. Emphasize pain and symptom management. D. Support the client's family during the dying process and bereavement. E. Extend life at all costs. F. Promote client autonomy and dignity. Answer: provide holistic care that addresses physical, emotional, and spiritual needs, emphasize pain and symptom management, support the client's family during the dying process and bereavement, promote client autonomy and dignity. This question assesses the nurse's understanding of the philosophy and core principles of hospice care. The keywords client in hospice indicate a focus on comfort, quality of life, and supporting both the client and their family during the end-of-life journey. Hospice care is palliative, meaning it focuses on relieving symptoms and providing comfort, not curing the disease or extending life aggressively. Holistic care, pain and symptom management, family support, and upholding client autonomy and dignity are all central to hospice care. Hospice aims to provide comfort and peace, allowing for a natural and dignified dying process. Question 39. The nurse is preparing a client for a magnetic resonance imaging (MRI) scan. Which information is essential for the nurse to obtain or ensure before the procedure? Select all that apply. A. Client's allergy status to contrast dye. B. Presence of any implanted metallic devices, e.g., pacemakers, artificial joints. C. Last menstrual period for female clients of childbearing age. D. Client's ability to lie still for an extended period. E. Recent intake of caffeine or stimulants. F. Current weight and height. Answer: client's allergy status to contrast dye, presence of any implanted metallic devices, e.g., pacemakers, artificial joints, last menstrual period for female clients of childbearing age, client's ability to lie still for an extended period. This question tests the nurse's critical pre-procedure assessment for an MRI, focusing on client safety and contraindications. The key phrase MRI scan immediately brings to mind the powerful magnetic field. It is absolutely essential to screen for metal implants, as they can cause serious injury. Pregnancy status, last menstrual period, is important because MRI safety in pregnancy is debated. Allergy to contrast dye is crucial if contrast is being used, and the ability to lie still is necessary for image quality. Recent caffeine intake or current weight/height are not typically critical contraindications for an MRI. Always prioritize client safety by thoroughly screening for metal and other contraindications before MRI. Question 40. The nurse is caring for a client with a new peripherally inserted central catheter, PICC, line. Which actions are appropriate for PICC line management? Select all that apply. A. Use a 10 ml syringe or larger for flushing. B. Change the dressing every 7 days or if soiled/loose. C. Measure the external length of the PICC line daily. D. Flush the PICC line with heparin solution every 8 hours. E. Administer blood products through the PICC line. F. Obtain blood pressure measurements on the arm with the PICC line. Answer: use a 10 ml syringe or larger for flushing, change the dressing every 7 days or if soiled/loose, measure the external length of the PICC line daily, administer blood products through the PICC line. This question assesses the nurse's knowledge of proper care and maintenance for a newly inserted peripherally inserted central catheter, PICC, line. The concept is PICC line management. Using larger syringes prevents excessive pressure on the catheter, regular dressing changes prevent infection, daily measurement checks for dislodgement, and PICC lines are suitable for blood product administration. Flushing frequency varies by policy and type of solution, but every 8 hours with heparin is not universal. Blood pressure measurements should be avoided on the arm with the PICC line to prevent complications. Remember that meticulous care is essential for preventing PICC line complications and maintaining patency. Question 41. A client is experiencing delirium. Which nursing interventions are appropriate to manage the client's condition? Select all that apply. A. Orient the client to person, place, and time frequently. B. Maintain a consistent daily routine. C. Provide a quiet, well-lit environment. D. Administer sedatives generously to calm the client. E. Encourage family members to visit and bring familiar objects. F. Avoid reorienting the client if they become agitated. Answer. Orient the client to person, place, and time frequently, maintain a consistent daily routine, provide a quiet, well-lit environment, encourage family members to visit and bring familiar objects. This question tests the nurse's knowledge of non-pharmacological interventions for managing delirium, a common and serious acute confusional state. The keyword delirium indicates a fluctuating and acute change in mental status. Frequent reorientation, maintaining a consistent routine, providing a calm and well-lit environment to minimize shadows and misinterpretations, and encouraging familiar visitors and objects all help reduce confusion and anxiety. Sedatives should be used cautiously and minimally, as they can worsen delirium. Avoiding reorientation when agitated is incorrect, as reorientation helps ground the client. A structured and supportive environment is crucial for managing delirium. Question 42. The nurse is preparing to administer medications to a client who has difficulty swallowing pills. Which actions are appropriate? Select all that apply. A. Crush enteric-coated medications to facilitate swallowing. B. Check if the medication is available in a liquid form. C. Consult with the pharmacist about alternative formulations, e.g., chewable, sublingual. D. Offer the client a full glass of water or a preferred beverage with the medication. E. Instruct the client to take multiple pills at once to get it over with quickly. F. Administer the pills one at a time, allowing the client to swallow each one individually. Answer. Check if the medication is available in a liquid form. Consult with the pharmacist about alternative formulations, e.g., chewable, sublingual. Offer the client a full glass of water or a preferred beverage with the medication. Administer the pills one at a time, allowing the client to swallow each one individually. This question assesses the nurse's problem-solving skills and safe medication administration practices for clients with dysphagia, difficulty swallowing. The clue difficulty swallowing pills highlights the need for careful and adapted administration techniques. Checking for liquid forms, consulting the pharmacist for alternatives, providing adequate fluids, and administering pills one at a time are all appropriate and safe strategies. Enteric-coated medications should not be crushed as it destroys their protective coating and can lead to gastric irritation or altered absorption. Instructing a client to take multiple pills at once is a choking hazard. Always prioritize client safety and comfort by adapting medication administration as needed. Question 43. A nurse is participating in a root cause analysis, RCA, following a serious client adverse event. Which principles guide the RCA process? Select all that apply. A. Focus on identifying the single individual responsible for the error. B. Investigate systems and processes, not just individual performance. C. Aim to prevent recurrence of similar events. D. Be conducted in a blame-free environment. E. Involve frontline staff who were directly involved in the event. F. Assign blame to ensure accountability. Answer. Investigate systems and processes, not just individual performance. Aim to prevent recurrence of similar events. Be conducted in a blame-free environment. Involve frontline staff who were directly involved in the event. This question tests the nurse's understanding of the principles of a root cause analysis, RCA, a systematic process for identifying underlying problems after an adverse event. The keywords root cause analysis and serious client adverse event highlight the focus on systemic improvement. RCA aims to investigate processes, prevent recurrence, operate in a blame-free environment, and involve frontline staff for accurate insights. The goal is to identify systemic failures, not to blame individuals, and to learn from errors to improve future client safety. RCA is a crucial tool for quality improvement and patient safety. Question 44. The nurse is providing education to a client on how to use an incentive spirometer. Which instructions are correct? Select all that apply. A. Exhale completely before placing the mouthpiece in their mouth. B. Inhale slowly and deeply through the mouthpiece to raise the piston. C. Hold their breath for 2 to 3 seconds after maximal inspiration. D. Exhale forcefully into the spirometer after inspiration. E. Perform 5 to 10 repetitions every hour while awake. F. Position the device upright for proper use. Answer. Exhale completely before placing the mouthpiece in their mouth. Inhale slowly and deeply through the mouthpiece to raise the piston. Hold their breath for 2 to 3 seconds after maximal inspiration. Perform 5 to 10 repetitions every hour while awake. Position the device upright for proper use. This question assesses the nurse's knowledge of correct incentive spirometer technique, a common postoperative intervention. The concept is how to use an incentive spirometer. Clients should exhale completely, inhale slowly and deeply, hold their breath at peak inspiration for 2 to 3 seconds, and perform repetitions frequently. The device must be held upright. Exhaling forcefully into the spirometer or exhaling after inspiration is incorrect. The spirometer is for inspiration. Proper use of an incentive spirometer is crucial for preventing atelectasis and pneumonia. Question 45. A client with a new tracheostomy requires suctioning. Which actions are appropriate for the nurse to take? Select all that apply. A. Apply suction for no longer than 10 to 15 seconds per pass. B. Apply continuous suction while inserting the catheter. C. Pre-oxygenate the client with 100% oxygen for 30 to 60 seconds before suctioning. D. Insert the suction catheter until resistance is met, then pull back 1 to 2 centimeters before applying suction. E. Limit suctioning to 2 passes per episode. F. Perform suctioning routinely every hour to maintain a patent airway. Answer. Apply suction for no longer than 10 to 15 seconds per pass. Pre-oxygenate the client with 100% oxygen for 30 to 60 seconds before suctioning. Insert the suction catheter until resistance is met, then pull back 1 to 2 centimeters before applying suction. Limit suctioning to 2 passes per episode. This question tests the nurse's knowledge of safe and effective tracheostomy suctioning techniques, which are critical for airway management. The keywords new tracheostomy and suctioning emphasize the need for meticulous technique. Applying suction for limited duration, pre-oxygenating, inserting the catheter appropriately before applying suction, and limiting passes all protect the client from hypoxia and tracheal injury. Suction should only be applied upon withdrawal, not insertion, and suctioning should be performed only as needed, not routinely, to prevent mucosal damage and bronchospasm. Proper suctioning technique is vital for maintaining a patent airway without causing harm. Question 46. The nurse is preparing to administer a blood transfusion. Which actions should the nurse take to ensure client safety? Select all that apply. A. Initiate the transfusion within 30 minutes of receiving the blood from the blood bank. B. Verify the blood product with another licensed nurse at the client's bedside. C. Obtain baseline vital signs before starting the transfusion. D. Infuse the first 50 milliliters of blood slowly over 15 minutes. E. Administer the blood transfusion over a maximum of 6 hours. F. Use a 22-gauge peripheral forecatheter for administration. Answer. Initiate the transfusion within 30 minutes of receiving the blood from the blood bank. Verify the blood product with another licensed nurse at the client's bedside. Obtain baseline vital signs before starting the transfusion. Infuse the first 50 milliliters of blood slowly over 15 minutes. This question assesses the nurse's critical responsibilities for safe blood transfusion administration, a high-risk procedure. The phrase "ensure client safety" is paramount. Initiating within 30 minutes prevents bacterial growth. A two-nurse verification at the bedside prevents wrong blood errors. Obtaining baseline vitals is crucial for monitoring changes, and infusing the first 15 minutes slowly allows for early detection of reactions. Blood transfusions should be completed within 4 hours, not 6, to minimize bacterial proliferation. While a 22-gauge fork can be used, a larger gauge, e.g., 18 or 20, is preferred for better flow, but patency and access are the most important. Strict adherence to transfusion protocols is non-negotiable for client safety. Question 47. A client is receiving continuous oxygen therapy via nasal cannula. Which nursing interventions are appropriate to ensure optimal therapy and safety? Select all that apply. A. Monitor the client's oxygen saturation and respiratory status regularly. B. Ensure the nasal cannula prongs are properly positioned in the nares. C. Encourage the client to breathe through their mouth for better oxygen intake. D. Provide frequent oral hygiene and moisturize nasal passages. E. Place no smoking signs prominently in the client's room. F. Increase the oxygen flow rate if the client reports persistent shortness of breath without notifying the prescriber. Answer. Monitor the client's oxygen saturation and respiratory status regularly. Ensure the nasal cannula prongs are properly positioned in the nares. Provide frequent oral hygiene and moisturize nasal passages. Place no smoking signs prominently in the client's room. This question tests the nurse's knowledge of safe and effective oxygen therapy administration via nasal cannula. The core concept is optimal therapy and safety. Regular monitoring of oxygen saturation, proper cannula placement, providing oral and nasal care to prevent dryness, and implementing no smoking precautions are all essential. Encouraging mouth breathing bypasses the intended delivery route and is incorrect. Increasing oxygen flow without a prescriber's order is outside the nurse's scope of practice and potentially harmful, especially for clients with chronic obstructive pulmonary disease, COPD. Always ensure the correct flow rate is maintained and client safety is prioritized. Question 48. The nurse is assessing a client for signs of impending respiratory failure. Which findings would be indicative of this condition? Select all that apply. A. Increased work of breathing with accessory muscle use. B. Paradoxical chest wall movement. C. Bradypnea or periods of apnea. D. Restlessness and confusion. E. Oxygen saturation of 95% on room air. F. Pink, warm, and dry skin. Answer. Increased work of breathing with accessory muscle use, paradoxical chest wall movement, bradypnea or periods of apnea, restlessness and confusion. This question assesses the nurse's ability to recognize critical signs of impending respiratory failure, requiring urgent intervention. The keywords impending respiratory failure point to severe deterioration of respiratory function. Increased work of breathing with accessory muscle use, paradoxical chest wall movement, indicating diaphragmatic fatigue, bradypnea or apnea, late sign of exhaustion, and neurological changes like restlessness and confusion, due to hypoxia/hypercapnia, are all significant warning signs. An oxygen saturation of 95% on room air is typically normal and not indicative of impending failure. Pink, warm, and dry skin is usually a sign of good perfusion. Prompt identification of these signs is crucial to prevent full respiratory arrest. Question 49. The nurse is caring for a client with a urinary catheter. Which interventions help prevent catheter-associated urinary tract infections, CAUTIs? Select all that apply. A. Secure the catheter tubing to the client's thigh. B. Perform perineal care with soap and water at least once daily. C. Keep the drainage bag above the level of the bladder. D. Empty the drainage bag when it is full. E. Ensure a closed drainage system is maintained. F. Use sterile technique for catheter insertion. Answer. Secure the catheter tubing to the client's thigh. Perform perineal care with soap and water at least once daily. Ensure a closed drainage system is maintained. Use sterile technique for catheter insertion. This question tests the nurse's knowledge of best practices for preventing catheter-associated urinary tract infections, CAUTIs, a major healthcare-associated infection. The core concept is prevent CAUTIs. Securing the catheter prevents urethral traction, daily perineal care removes bacteria, maintaining a closed drainage system prevents pathogen entry, and using sterile technique for insertion are all critical measures. The drainage bag must always be kept below the level of the bladder to prevent backflow, and it should be emptied before it's full, e.g., when 2/3 full, to prevent overflow and pressure. Meticulous catheter care is paramount to prevent infection. Question 50. A client is being prepared for discharge with a new ostomy. Which statements by the client indicate a need for further teaching? Select all that apply. A. I will avoid all raw fruits and vegetables from now on. B. I should empty my pouch when it is about 1/3 to 1/2 full. C. I will change my entire ostomy system every day. D. I know to call my doctor if my stoma looks pale or dusky. E. It's normal to have some gas and odor from the ostomy. F. I will cut the opening in my skin barrier a little larger than my stoma for comfort. Answer. I will avoid all raw fruits and vegetables from now on. I will change my entire ostomy system every day. I will cut the opening in my skin barrier a little larger than my stoma for comfort. This question assesses the nurse's ability to identify misunderstandings in a client's ostomy self-care knowledge, indicating a need for further education. The phrase, need for further teaching, points to incorrect or unsafe statements. Avoiding all raw fruits/vegetables is too restrictive, many can be gradually reintroduced. Changing the entire ostomy system daily is usually unnecessary and can irritate the skin, typically, it's every 3 to 7 days. Cutting the skin barrier larger than the stoma allows effluent to contact and irritate the skin. Emptying the pouch when 1/3 to 1/2 full, reporting color changes, and understanding that gas/odor are normal are all correct statements. Always clarify any misconceptions to ensure safe and effective self-care at home.